Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. I'm joined today by two very special guests. I'm going to let them each introduce themselves, but we have a great conversation here on value-based care today. And, without further ado, I'll start off with one of them and then they'll kick it over to our other guest. But first guest, Dr. Frank Osborn.
Thanks, Jared. My name is Dr. Frank Osborn. I'm a family physician. I came out to this area where I've been practicing in 1999. So I've been in healthcare for 25 plus years. My current role, I'm the CMO for Tufts Medicine Integrated Network. I do various different projects. I've been a little spoiled in my career. I've been in organizations that are kind of big enough to do a lot of things, but small enough that I get to do everything. So I've had a nice blend of contracting, operations, innovation, you name it. I've kind of done it within that framework. As we kind of grow and expand, and as we did our healthcare journey, we kept looking for what are opportunities that we can kind of accelerate our process. All these aspects we kind of knew how to do, but we were looking for a partner that could really leverage that and make it happen on a faster timeline. And that's where we really turned to Navvis in this process.
And I'm Mike Eaton. I am the Navvis Healthcare Market President for the partnership with Tufts Medicine in the Massachusetts market. And I've had a long background in health systems and physician enterprise development. I was a senior executive at Aurora Healthcare for a long time. I've had the privilege of being at Tufts actually since 2016. Providing on a consultant basis services across the whole of the system, the hospitals, physician enterprise. Most recently, I served as the Vice President of Strategy for Tufts Medicine. But now I'm on the Navvis side, and I get the opportunity to work with Dr. Osborn and the team as we're looking to transform how we care for populations, how we improve health care experiences, equity, and cost in that market.
Well, I'm excited for this partnership between you two. Would love to hear a little bit. Maybe we can kick it back over to Dr. Osborn, or Mike, we can stick with you. How it came to be. Like, how did this partnership finally formalize?
Yeah, I can kick that off. As a network, we had actually recently come together, the Lowell General PHO and NEQA, to form a new network. We had 14 physicians come together, the G14, and we really tried to think ahead and found like a physician-driven network, and really created kind of the give and the get from the network. The network is going to provide you with the services and expertise to be able to execute on what you need to do. The give, you're going to be held accountable by your peers to really deliver care that you need and really feel that you belong to a group and a culture to be successful. With that in mind, we looked to the marketplace and we looked at a number of different vendors who we could partner with. And I think a big thing for us that resounded was culture. Working with Navvis, I think we could finish each other's sentences. I think they believe that idea of bringing private practice and a physician-driven kind of product to market is key to their success. And I'm sure Mike can talk a little bit more about that.
Yeah, and one of the interesting pieces of how we came together is we were already performing fairly well in the marketplace. Dr. Osborn referenced the 14 physicians who came together to consolidate, unify our two different physician enterprises, physician networks. But as we talked about it, we wanted to not simply continue to perform well, we wanted to really materially do something different. We wanted to make a new market, to really transform. And we knew we couldn't do that at scale fast enough on our own. So we went to look for a partner. And as Dr. Osborn noted, we looked at many, and Navvis was the one who really shared our vision, our mission, our point of view on the imperative to have physicians have authority and accountability. Our system CEO, Mike Dandorf, was a big proponent of this. Let the physicians lead. And that's really how we came together. It was not born necessarily of what are the specific programs and services, although that was important. But it was really that we shared a common view for what the future should look like.
Yeah, and I would just say that's not the case with a lot of different entities we talked with. I think there's pressure in the marketplace, and Mike can speak to that as well, of physicians really want to feel like they have some control over their lives and they're not either owned by a pharmaceutical company, a health plan, or venture capital, and that they really feel involved in that care. And I think as a differentiator, that's important, but also as a drive to kind of combat physician burnout. We're trying to really instill that we're controlling our own destiny on that path.
And talk, we'll stick with you, Dr. Osborn, and then we'll kick it back to Mike again. The shift to value-based care. So I feel like we've been hearing about value-based care for a very long time, and it seems like it's like finally getting its due, right? Depending on who you talk to. Let's talk about though what that shift to value-based care looks like, and then how this will transform all aspects of care delivery.
Yeah, no, I feel, been 25 plus years, and if you include medical school, I think it's been 30 plus years where everyone said healthcare was broken and we're moving to a different product or a different approach. I think in Massachusetts, we had a little bit of jumpstart, and it might be a little myopic just being in my own realm. AQC, which is the Alternative Quality Contract, kicked off for Blue Cross Blue Shield in about 2008. So we've been kind of chips all in for over 15 years, along with us doing the MSSP. I think that change moved us from a contracting agency to a population health company in that journey. And for us, it transformed not being a big player in the market. We were able to increase our fee schedules by doing quality work and by being efficient. In turn, that allowed us a good position in the marketplace. So we've been doing that. I think the change we're looking for is it hasn't resulted in complete reduction of TME in a way that hits the consumer. It has helped us and our bottom line, but I think to be truly transformational, we need to deliver that value to the consumer.
Yeah, I think like Frank, 1989 was my first foray into the healthcare sector. I started working for the Wisconsin Medical Society, and in my first week, they sent me out to give presentations to physicians talking about this thing called value-based care or population health or managed care. And it's been almost 35 years, and we still haven't really fixed it, in part because we've never really gotten concrete about it. We don't really understand very well what it is. But I think where we've really moved as Navvis and Tufts Medicine and Tufts Medicine Integrated Network is to bring this down to something that people can really get their head around in terms of what it is. It's right care at the right time, at the right place, with the right provider, at the right price, the first time. So how do I make certain I get connected to what I need so I can keep healthy people well, slow the progression of chronic disease in the community, fill gaps in care, which can be about affordability, it can be about equity, it can be about access. And how do I do that in a way that is really seamless? So it feels as a consumer like I have an opportunity to access the things I need on my terms and time in a way that makes sense. And that's really when we think about managing populations, health, the overall health of a population, the care outcomes, the cost, access, all of that. That's really where we're trying to get to. And I feel like with this partnership, we've kind of crossed that chasm from the theoretical premise of population health to actually delivering on that promise in a way that helps people live better lives.
To breathe some life in that, I'll give the example using Navvis's model. We've done the One Care Team kickoff. So One Care Team consists of nurse care managers, pharmacists, social workers, and community healthcare workers. And unlike most times within traditional healthcare settings, those groups are either centered around institutions or they're centered around a contract, like an insurance contract, like this is what we do for Medicaid, this is what we do for Medicare, this is what we do for Blue Cross. These teams are centered around offices. So I know who all those entities are. And the patient I'm caring for, operationally, it doesn't matter what insurance contract they have. We're having a One Care Team approach to that person. and that continuity of care within that team. Along with that, Navvis has some scalable products to increase high touches amongst those patients. And just last week, when we fully deployed this, I came into my inbox. I had 6 messages from my care manager, and we were actively managing these patients in real time through the record, something that just doesn't happen in a functional way in my past experience.
What's next? How do you continue to track the progress of this relationship? What does success look like for, I guess, the both of you when it comes to this partnership?
Well, I think there's a number of metrics we've really focused on that sit at that intersection of keeping healthy people well, delivering the right care, right time, right place, right cost, and the experience that not just the patients have, but our clinicians have. So we look at things like utilization of the emergency department or avoidable hospitalizations. We know people heal better and faster at home. If we can keep them out of an acute care setting, that's great. That we track on that. That tells us we built a healthy partnership. But equally important, trying to avoid overutilization of care is thinking of underutilization of care. So there are people who need complex specialty services. How do we get earlier disease identification, escalation to the right place, which may be an acute care hospital? But how do we do that in a way that puts the patient at ease, makes it easy for them, simple to connect? Today, healthcare really comes with some assembly required for most of us. When we're sick and we need services, we have to go through a lot of things to get connected to the care we need. I think for us, when we look at the health of this partnership, Navvis and Tufts Medicine, it's really people are finding it easier. We're making it easier for them to do the right thing, get the right care they need at the right time.
We have multiple roadmaps with multiple KPIs, but stepping back to the bigger picture, I would just layer on going, from the triple aim to the quadruple aim. We need to give better quality. We need to have patients have a better experience. We need to give, care at a lower cost price, and we need a better environment for physicians to do and grow. And part of that, I would like to create opportunities where not only do we become the place to be for a physician within our network or within the state, but also a growth from our partnerships and education that we see more physicians going into primary care because they see it as a better opportunity. They're getting better lifestyle, they're getting a better pay that they want, and really giving that joy back to medicine that I think has been missing. Generationally, I came out 60% of doctors or more went into primary care. It's probably down less to 30%. I kind of feel a weight and an impetus to really create a new environment that reestablishes that and brings that joy and love and interest back to caring for patients at a different level. So for me, if I accomplish that, that will be a success.
Well, I'm excited to stay in touch with both of you and continue to hear how things are going, but really excited that you have this partnership and that you're moving healthcare forward. And thank you so much for both of your time today.